Hello and welcome. Today we're diving deep into a rare and complex heart condition called arrhythmogenic right ventricular cardiomyopathy, or ARVC. This is a disease that primarily affects the heart muscle, leading to potentially life-threatening irregular heartbeats. So, what causes ARV? In most cases, it's a genetic condition, meaning it's passed down through families. Specific genes responsible for building the structures that hold heart muscle cells together, known as desmosomes, are often mutated. These mutations disrupt the normal connections between heart cells, leading to the development of ARVC. In some rare instances, ARVC may occur without a clear genetic link, and the cause remains unknown. ARVC primarily impacts the right ventricle, one of the heart's two lower chambers. The disease process involves the replacement of healthy heart muscle cells with fatty and fibrous tissue. This process, called fibrofatty replacement, weakens the right ventricular wall and disrupts the heart's electrical system. As a result, the heart becomes more prone to developing dangerous arrhythmias, or irregular heartbeats. These arrhythmias can range from palpitations to ventricular tachycardia and ventricular fibrillation, which can lead to sudden cardiac arrest. ARVC is considered a relatively rare disease. Estimates vary, but it's believed to affect about 1 in 2,000 to 1 in 5,000 people. It's more commonly diagnosed in young adults and athletes, especially those involved in endurance sports. This is because the increased demands on the heart during strenuous activity can exacerbate the underlying condition, increasing the risk of arrhythmias. Though it affects individuals from all backgrounds, some studies suggest a slightly higher prevalence in certain regions and populations. The signs and symptoms of ARVC can be quite variable. Some individuals may experience no symptoms at all, while others may have significant problems. Common symptoms include palpitations, feeling like your heart is racing or skipping beats. Dizziness or lightheadedness, especially during or after exercise, is another concerning symptom. Fainting, also known as syncope, can occur due to a sudden drop in blood pressure from an arrhythmia. Chest pain and shortness of breath, particularly with exertion, can also be present. And, tragically, the first sign of ARVC can sometimes be sudden cardiac arrest. Diagnosing ARVC can be challenging, as there's no single definitive test. Doctors rely on a combination of diagnostic tools and clinical findings. An electrocardiogram, or ECG, records the heart's electrical activity and can reveal abnormal patterns suggestive of ARVC. An echocardiogram uses sound waves to create images of the heart, allowing doctors to assess the size and function of the right ventricle. Cardiac magnetic resonance imaging, or MRI, provides detailed images of the heart tissue and can help identify areas of fibrofatty replacement. An electrophysiology study, or EPS, involves inserting catheters into the heart to map its electrical activity and induce arrhythmias, helping to determine the risk of future events. Genetic testing can also be used to identify mutations in genes associated with ARVC. While there aren't specific subtypes of ARVC defined by strict classification systems, the disease can manifest with varying degrees of severity and predominantly affect different regions of the right ventricle. Some individuals may have more localized disease, while others have more widespread involvement. The specific pattern of fibrofatty replacement and the type of arrhythmias experienced can also vary. Because of this variability, treatment plans are often tailored to the individual patient's needs. The treatment of ARVC focuses on preventing sudden cardiac arrest and managing symptoms. Medications such as beta blockers and antiarrhythmics can help control heart rate and reduce the frequency of arrhythmias. An implantable cardioverter defibrillator, or ICD, is a small device placed in the chest that monitors heart rhythm and delivers an electrical shock to restore a normal heartbeat if a life-threatening arrhythmia occurs. In some cases, catheter ablation may be performed to destroy the areas of the heart muscle that are causing arrhythmias. In severe cases of ARVC with advanced heart failure, heart transplantation may be considered. While there's no guaranteed way to prevent ARVC, particularly as it's often genetically determined, several measures can help reduce the risk of complications. Early diagnosis through family screening is crucial, especially for individuals with a family history of the disease. Avoiding strenuous exercise, particularly endurance sports, can help minimize the workload on the heart and reduce the risk of arrhythmias. Regular follow-up with a cardiologist is essential to monitor the condition and adjust treatment as needed. Living a healthy lifestyle, including a balanced diet, regular moderate exercise, and avoiding smoking, can also contribute to overall cardiovascular health. The prognosis for individuals with ARVC can vary depending on the severity of the disease, the presence of arrhythmias, and the effectiveness of treatment. Early diagnosis and treatment can significantly improve outcomes. The risk of sudden cardiac arrest is a major concern, and the use of ICDs has dramatically reduced mortality in high-risk patients. Researchers are actively investigating new therapies and strategies to better understand and manage ARVC. Current research is focused on gene therapy, advanced imaging techniques, and the development of more targeted medications. These advances hold promise for improving the lives of those affected by this challenging heart condition.